In this video, I'll go over what to prepare before scanning your patients. First, keep your scanner tips clean. Use microfibers or a gauze to wipe the tip mirrors. If you use alcohol wipes and let it dry, it may leave residues behind. Wipe off the alcohol, but be careful not to scratch them. A clean scan data will look like this, and dirty tips with residue and scratches may look like this. Follow the correct sterilization procedure for the scanner tips. For the i500, you can autoclave 50 times at 121 degrees Celsius for 30 minutes. For the i700, you can autoclave them 100 times at 121 degrees Celsius for 30 minutes using a gravity-type autoclave, and 134 degrees Celsius for 4 minutes using a pre-vacuum type autoclave. Avoid any external lights as well as direct sunlight, as it can interfere during scanning. A warning light will pop up in case there are external lights, but this can be turned off in settings. Check the oral condition for any bleeding. A dry condition is recommended as the scanner can capture anything it sees, such as blood, saliva, bubbles, etc. If you're prepping your crown subgingivally, then cord packing is necessary. You can substitute cords for retraction pastes or lasers, as long as you're able to capture the margins. For implant cases, you need to use scan abutments or scan bodies. They are digital impression copings, and every implant company has its own design. MegaGen has the 9mm and the 13mm scan body, as well as the scan healing abutment. The 13mm is for the anterior, and the 9mm is for the posterior. The scan healing abutment functions as a scan body, as well as the healing abutment. However, it does not have to be taken out. Instead, a scan post is capped on top of the abutment for scanning. Here is a brief implant process. First, the healing abutment is taken out of the patient's mouth. Then, the emergence profile is scanned. Next, the scan abutment is placed with the flat side facing the buccal or lingual. This is because the flat surface is the reference point. They are important as it helps the software identify what type of scan body is being used. Scan bodies from other implant systems will have different reference points. Remove any blood on the scan body before scanning. In summary, remove any stains, scratches, or residue on the mirror tip for clean scan data. Turn off any direct light. Remove any blood, saliva, or bubble. Use retraction cord, paste, or lasers if the margins are subgingival.